My name is Sally Flashberger. I'm with the Wisconsin Board for People with Developmental Disabilities, and I'm joined by Jenny Price and Matt Glowacki. And we're here to talk about a new program that we have at BPDD called the Wisconsin Disability Policy Program. And it's a new program, and we are entering our second year of it and wanted to provide some information to everyone at the Self-Determination Conference about the work that we're doing. So I'm going to get us started, maybe. All right. So the Wisconsin Disability Policy Program is a new program that we were funded for 3 years. We received funding from the Inclusive Foundation. The Inclusive Foundation was set up when the managed care organization Inclusa sold to Humana, and they were required to set up a foundation. And so the Inclusive Foundation approached BPDD on setting up a policy leadership program in the state. We already do what's called partners in policymaking, so it was a good fit for us to be doing this work. And we are just about to start our second year of the program. And the program focuses on disability policy that is impacting people within our long-term care system. So that is one of their goals at Inclusa. And what it was designed to do was to give individuals with disabilities and family members an opportunity to work in state agency offices, the legislature, or advocacy organizations. And, you know, our goal is that we're really giving people a career opportunity. So we know that there are so many great advocates out there who are really interested in making that leap from kind of that volunteering or that community organizing and really getting into policy. And so this program is really meant to be kind of a career advancement. In addition, it also is about bringing that lived experience into these different organizations. So making sure that people with lived experience are helping create policies and advocacy strategies in the state. And so that's really important to us, is this lived experience. So some of our goals, again, we're trying to empower future leaders. So giving people the knowledge and skills that they need to be policy advocates out there. That professional development, so providing a valuable work experience and boosting those career options in the disability policy field. And then that impact, so better community impact through that lived experience. So I'll just give you an example for myself. I'm the mom of an adult with a developmental disability, and when I used to work in printing. Somebody just asked me this today, and I knew that I really wanted to switch careers, which can be pretty difficult when you really haven't worked in the policy field or disability. So I started doing a lot of volunteering at my school district. I then ran our special ed advisory, and luckily I did find an opportunity, but sometimes those opportunities are really not out there. And I did start at I was putting kids in foster care on SSI. I did their SSI applications in child welfare, and it was a pretty entry-level job when I started, and I was kind of, you know, almost 40, and you know, slowly moved my way up. And so we're trying to help people maybe make those leaps a little more easily into this policy field. So we offer 2 opportunities annually. So we have a full-time paid fellowship. We place 2 fellows a year, so that I'll go into a little bit more depth about that. And then we have a 6-month part-time paid internship. And we are actually recruiting for our internships right now. One thing I want to say about the internship is a lot of times people think, oh, I'm, somebody coming out of college, or I'm a young person. We only named it internship because that was kind of the language that most people could understand within the state to kind of have this employment opportunity. But really, we are looking for anyone, any age, any level of experience. We'll talk about that a little bit, but we don't want people to think you got to be, 20 years old coming out of school. So it's really open to anyone. So who should apply for our program? Well, again, you have to be a person with a disability or a family member of a person with a disability to apply. Again, showing that commitment to disability advocacy and policy, and really demonstrating some interest or work that you've done in that area. And this could be volunteering. It does not have to, it could be grassroots advocacy work. It does not have to be paid work. Good communication skills, that ability to work as a team and get along with others. Having some knowledge or interest in state and local advocacy related to disability, long-term care, employment, education, or community organizing is helpful. Having some type of experience, paid or volunteering, working with individuals with developmental disabilities, previous leadership experience for sure for our fellowship. Maybe you are leading something at your school district on a volunteer level, or maybe something in the community that you might be doing. And then some knowledge of our legislative process and long-term care system is always a plus when looking at these two programs. So I'm going to talk a little bit about the fellowship. We just finished our placement for the second year. So our next opportunity for the fellowship will be in the summer of 2026 is when we'll launch that application. It is a 12-month full-time paid experience that begins in September of each year. Fellows receive a $63,000 stipend to participate in the program. And we have additional funding for technology, transportation, and healthcare. We offer a small healthcare stipend. That level is really coming in at our kind of state policy analyst level. That's kind of a entry-level pay. So we tried to model up against that. It's a little bit different than a regular employment opportunity, as we offer it kind of as a grant. So you become a contractor with BPDD, and then you are placed at a different placement. And our placements last year was the Division of Medicaid Services and the Division of Vocational Rehab. This year, it's at the Division of Medicaid Services and the Division of Quality Assurance. And so our fellowship is generally going to be within our state agencies. That was important to our funder, especially within the, I need a Kleenex, especially, I have some allergies. Of course, they're rearing their ugly head. That was really important for them to have someone within the Division of Medicaid Services on an annual basis. Fellows, not only are they working within these organizations, but they can participate in workshops and training sessions. I do a monthly training session once we bring on our fellows and interns to really talk about policy and to learn about all the placements that are participating in our program. And then we also can support them to attend different workshops around the state, depending on what is their area of interest. We really want them building those connections with different professionals in the policy field. So once you get into a placement, you're meeting the people at your placement, but then whatever we can do to help them meet others in the field. And they generally, fellows follow that work schedule of whatever the placement is. And most of the work has been virtual. Sometimes people have to go for in-person meetings, but you're really working Monday through Friday, 9 to 5 or 8 to 5, and some flexibility there. All right, I'm going to turn it over to Jenny. Jenny was one of our first year fellows, and she's going to tell us all about her experience and then the real exciting news that happened at the end. Well, not even at the end of her placement.
That one. Okay. Yep. Okay. Hi, everybody. All right. So, as Sally said, my name is Jenny Price, and I guess I'll start by sharing a little bit of my background. So, I came into this with a career experience mostly as I had been a journalist for 10 years, and then I worked in the communications field for a long time. And you can kind of see the different things I've done here. My press pass cracks me up, I guess. So I always put that on there. So I've long had an interest in like politics and journalism. And my sort of pivot into being interested in policy came the same reason as Sally. I'm a mom of a 16-year-old son who is autistic. And so as we were navigating systems for him, obviously I was trying to figure that out, but I also became super interested in kind of bigger problems that I saw lots of people were having. So I am a graduate also of the Partners in Policymaking program. And I have the asterisk life-changing experience because it really was. Learned so much about the history of disability advocacy in our country and policy. And it was sort of like there was no going back. There was no turning around. So I really spent about 4 or 5 years thinking about like, how can I move into this, and was doing kind of volunteer advocacy as well. And then when I learned about the fellowship, it really felt like a door was opening. Actually, before the fellowship started, I began this graduate program doing, and I'm actually finishing my graduate certificate in 6 weeks, I hope. Working, going to school I don't recommend it. So as I said, my lived experiences, this is my son, this is Danny. And, so as many of us know, navigating these different programs is very complex. And these are some of the experiences I've had coming into this fellowship, working in school system, working with DVR. And then I'm really finding now that I have been in DHS, it's been a little bit useful as well, being the daughter of more elderly parents. So my placement, as Sally mentioned, was in the Division of Medicaid Services. And I made this chart because we'll think of the org chart of the Department of Health Services as it would not fit on a slide. So think of this as a very small piece of that. So Division of Medicaid has several bureaus in it, but these are the 3 bureaus that I rotated through in my time in the fellowship. The first one, the name means nothing and don't worry about it. But what I'll say is that it involved adult long-term care programs, like many of us know, like Iris and family care, and kind of we'll say the day-to-day operations of it. Bureau of Children's Services, as many of us know, is where all the children's programs are, including the CLCS program. And the Bureau of Programs and Policy is also adult long-term care, but it's kind of more the front end, which would mean like the contracting and sort of quality measures and things like that. I'll just keep it basic. So we thought it would be useful because you're probably thinking like, well, what did you all do? So I wanted to share a couple of concrete examples of things that I had the chance to work on. So the first was in coming in, I got kind of involved in what we would call sort of a special project or ad hoc project in the agency. DHS had spent a couple years looking at systems that impacted people with both IDD and mental health needs. And so there was a group that before I even got there, had worked on sort of a study and a series of recommendations. Well, one of the recommendations was making sure that people who were involved as caregivers, either as family members or caregivers, I can't say that, caregivers, sorry, my allergies are down here today. So making sure they had the right training, because as many of us might know, a lot of people end up in crisis. They might end up in mental health institutions and kind of cycling in and out of their homes and through that. So the goal was trying to figure out what are some of the pain points in the system that could be handled. So this is an attempt group that's working on creating a training program specific to caregivers working with this population. So these are the things that are going to be included in the training. And how I came into this group was I think they thought, well, this will be interesting for her to hear about. So I did spend a lot of time just listening and learning about it. But now as we've actually gone into the writing the course, this is where, and I think this is great for all of us to think about who might be interested in doing this. The skills I brought in with me have come in handy because I have a communications background. So I've had a lot of feedback on some of our delivery of the training and sort of like what some of the slides might look like. So been able to sort of combine my past experiences and contribute to this project. And then this is the one where I'll start this by saying, at some point in the middle of doing this research, I looked at my husband one night and said, I'm out of my element. um, because while my son is in CLTS, I certainly had never read a CLTS waiver. Has anybody here read a federal waiver before? I don't recommend it unless you have problems sleeping. Um, I was sort of assigned to look into some different aspects. I mean, as you all may know, the waivers are what allow the state to operate these programs like CLTS or IRIS or family care, and they have to be renewed. So about every 5 years, that process happens. And folks like what I was operating as, which is an policy analyst, do research, come up with lots of information so the people who are the decision makers can make recommendations, talk with folks like people in this room, find out what people are interested in doing. Well, part of that is reading waivers from other states. So I spent a long time doing that, but I will say I learned so much about how complex the systems are. And I want to pause and say, and I'm sorry for being disorganized about this thought, but one of the reasons that I really wanted to be in Medicaid was because of its tremendous impact on both the person in my life that I care about, but also how many people in this state impacts. It felt like it was a really great opportunity to learn about all these programs that do affect so many people. So long and the short of this is I did a lot of reading. I learned a lot about waivers and was able to sort of get to a working knowledge for the project I was given. So that was pretty exciting to sort of feel like I knew what I was talking about a little bit at the end of it. The other thing I was able to do was work with an existing staffer in the department. Actually, Tammy Huffmeister, if any of you know who she is, she just retired, but a real ace on competitive integrated employment. And so we worked together on trying to visualize some of the data that we had and get that out so that people could see sort of what the progress or the trajectory had been for the program. This was another place where I was able to bring in my past experiences because I've spent a lot of time in my life doing visuals and doing things with like magazines and things like that. So it was fun to be able to kind of improve something with something I already knew how to do. One of the things we wanted to talk about was sort of lessons learned. And in addition to the things on here, which I'll get to, I think the thing I really want to say is this all seems really smooth the way I just talked about it. But I really went in and did not know anything anyone was saying for the first very long while. And so it took a lot of patience with myself and with other people, a lot of just listening and sort of taking in and then figuring out what my questions were. And what's great about the program is you have access to leaders in the bureau that you're working in, and you have the chance to talk with them and say, in that meeting when people were talking about that thing, then you can sort of talk it through and understand better what was going on. So I think that was what was really valuable for me about the program, was getting the chance to ask those questions and to learn. So yeah, I think being patient, being persistent, what I will say is that I think I always thought Medicaid was complex, and now I know it's more complex than any of us possibly imagine. I saw a quote from somebody recently, and they said, if you were going to design the system from scratch, you would never do it this way. And that's probably true. And that's actually something someone in the department shared. It's been pieced together over the years. So I had to really, I'm used to like figuring things out. And I had to really understand that even people that have worked there for a number of years are still learning things every day about the system. Um, the other thing that I think was really important for me to learn was to be willing to pitch in where I thought I could, be willing to offer my perspective where I thought I could. An example I can give is I did work in the Bureau of Children's Services, and we'd be talking about what a support and service coordinator is supposed to do in any given situation. And I think I kind of found my voice in some of those conversations where I was like, well, that's actually not how it happens because I'm in those meetings with my son. And so that's, I think, the really valuable thing about the program and why it was invented is that our voices as advocates or self advocates are so useful in those conversations because we know what it looks like or we know what our experiences have been. And I will say that was always appreciated. Like nobody looked at me and said, what are you talking about? They were like, oh, really? Like, tell me more about that. Like, there's a curiosity there. And the other thing I want to add is that I think I went into this experience thinking, well, I don't know what any of these people are going to be like. They're these like government bureaucrats. Government bureaucrats get a bad name these days, but everybody I met is there because they're really passionate about Medicaid and the programs and what the programs can do. So many people that work there have like direct experience as like case managers or social workers. Or I met so many people who are like, oh, I have a brother with a disability, or oh, my brother is autistic, or my sister. Like so much also advocacy experience in their lives. So that was really something I did not expect and really appreciated because I've been able to learn from people kind of in that way too. Um, and yeah, I'll just sum up by saying I think bringing yourself is the most important thing. I think this presentation may feel intimidating because of all the things we're talking about in a short time, but I just really, if you have any interest at all, I would really encourage you to look at it more because every person's experience in this program, I think, is going to be a little different. So that's just something to keep in mind. And lastly, I feel like I'm talking too long, so I'm going to jump in. So, as Sally said, the goal of this program is for people to work in policy. Partway through this experience, I started talking with my supervisors, and people would be like, "What are you thinking? Do you think you might want to work here?" And I'd say like 2 months in, I was like, "I don't know." And then, about 6 months in, I thought, "Yeah, maybe." And the process of working for the state, hiring for the state is very lengthy. And so I took someone's advice and just kind of started applying. And I'm very happy to say I actually got a job. So um, thank you. Uh, so I'm actually working in the last bureau in that chart I showed you, the Bureau of Programs and Policy. And I put I put the place I'm working on there, and I actually have had to text this to my mother because she's like, "What's your job again?" So I'm a program policy analyst in the Bureau of Programs and Policy Quality and Special Initiatives. And what that means so far is our team is involved in contracts with HMOs and managed care organizations that operate these programs and really focused on quality improvement. And what that just means is making sure that they're doing what they're supposed to do. It can mean things like I've had the opportunity so far to work in what we call pay for performance. So like, a certain amount of the money is withheld ahead of time and they have to, meet their part of the bargain. And if they do, then they get that money back. So I'm excited to be in that area of things because I think that feels like there's a lot of potential for impact. Um, and but at the same time, I have a huge document of acronyms that someone was kind enough to share with me, and I add to it almost every day. So it's I'm learning a new language all the time. But I think it's been just so positive, and I'm been really excited about it. I put this link on here, and I think this will get shared. But one thing to know about applying for the state, and if anybody wants to talk more about this, we can. They have a very specific process, and my biggest caveat would be it's not like applying for any other job. So there's definitely steps to take. And I know Matt has things to say about that as well. Um, so that feels like it ended with a thud. But anyway, I am just so grateful to BPDD for the chance to do this. And I think I'll definitely be happy to answer more questions.
Yeah, I thought we'd pause now because we're going to talk about the internship and see if there were maybe any questions about the fellowship.
So the design was 4 months in each. Yeah, she was curious how long I spent in each of those bureaus in that chart that I showed you. So it was 4 months in each. I ended up leaving early with Sally's blessing from the last one. I finished at about 9 months. And I will add about that. What was great is I had started working on certain projects, like this project I mentioned, working on the training for IDD mental health. I'm actually still working on that because my bosses felt like that fit my current role. So I kind of joked that I was like a lint ball and I was collecting things as I went. So by the time I was done, I was kind of working on things in all three.
Yeah. And this year they've decided they're going to have the fellow work in all three bureaus at the same time. So we're seeing that's working its way through right now. Just from a capacity standpoint, they thought from a supervision standpoint, it might be, they would be sure to be able to give that person all the work, enough work. But we're seeing if that's going to be the best way. And then the person who was placed at DVR, they also were working on policy, but they worked on multiple projects. So it's a lot of it can be project based, I would say, so that the person can feel like they're completing something before they end the fellowship. When you say, any other questions? Yeah, we can do more later for sure. Yes, and we one of the things that we do that I do once the application comes out if it is I have been doing information sessions. So we just did the one for our internship, and actually this time we did add some information about applying and interviewing and all of those great things so that people would feel like they had a little bit more information. So I'm going to talk about the internship. So we are actually in our recruitment phase right now. Our application is on our website, and the application will close on October 31st. The internship is a 6-month paid part-time. That should say 24 hours because we were able to bump that up last year. It's 24 hours a week, and it begins in January and runs for a full 6 months. So once you get placed, we did have people who were able to continue a little bit longer just based on their work schedules. I think what we found with this, and this is kind of what I was talking about from that internship perspective, is we had a lot of great quality candidates who just maybe couldn't, due to maybe family members with caregiving responsibilities. Also, we've talked to many people about the concern related to their benefits. And so a 24-hour opportunity was a little bit more attractive for them. And so, really it's not about, being this young out of college intern. So we don't want you to think that. I got to keep pressing that because we want to make sure people apply. Interns receive a $20 an hour stipend, so it is based on the number of hours that you work. But then we also still have funds available for technology and transportation. And just like our fellowship, you're paid through a contract with BPDD. And our interns are placed again within state agencies. We placed within advocacy organizations. And we are hoping to have a placement in at least one legislative office. We're working with the internship program in the legislature now to see if they will take a placement. So that's kind of our year 2 goal, is that we get a placement with a legislator. Interns, just like fellows, have that same opportunity to build those connections with professionals in the field. We definitely do those monthly trainings. They are involved in that. Our interns also follow a normal work schedule during the week. So most of our agencies are working sometime between 8 and 5. And, it's really working together with the placement agency to determine what hours are going to work the best for the person. And again, it's generally mostly virtual work. There can be some in person just based on if they're having a meeting or maybe they support some type of conference, those types of things. So we want to make sure that people have an opportunity to be as involved with their placement agency as possible. So whatever works for you, we're going to work for that. I think one of the things too is my role, which I didn't really talk about, is really to be there as a mentor. And so not only do you have somebody at the placement who's your supervisor, but there's also you're meeting, the people meet with me weekly. We, kind of talk about, we don't get into the nitty gritty of all the work because a lot of it is confidential. But we talk about, different strategies, if there's anything that's going on. We talk about opportunities that they might have seen for different trainings or things that they want to attend. And so I am there to be a support for the fellows and the interns, but then also the placements. And so I meet with the placements monthly to make sure that we're on track and that everything's going well. All right, I'm going to introduce Matt. He was one of our first year interns. He'll talk a little bit about his experience. Matt came with a lot of great experience. He served as the Inclusion and Belonging Director for Wisconsin SHRM. And he'll tell you what that is because I don't know what that stands for. It's something with human resources. And he currently is the Jefferson County SHRM president. He's won an award. He won an award with them last November for their How to Hire International Workers at the. He won an award last November for their How to Hire International Workers at their state conference. I think that's what that says. Matt also participated in Partners in Policymaking. And, I think that is a program, that program is still open too for applications until October 27th. We had a lot of people who have participated in Partners in Policy who apply for that. He served on the Governor's Rehab Council, the Wisconsin Easter Seals State Board, the Whitewater College of Arts and Communication Dean's Advisory Board. Matt has he has been a member of the Paralympic sitting volleyball team for 8 years and has played matches in 26 countries and competed in the 2000 Paralympics in Sydney, Australia, and in the World Cup in Egypt. And he has published a book called Able Bodied Like Me, and it was reviewed as a perspective discussion of disability and bias. So I'm going to turn it over to Matt.
Oh, yes, please. I love the clicker. Now I'm in control. Oh, no, I love it. Hello, hello. My name is Matt, and I really appreciate being here. The person who I owe all of this to is sitting here at the table, and her name is Sally, and she's given me a life. I really want to let everybody know that. Seriously, thank you. I have some pretty incredible experience. I've been a professional speaker all across the country. I've spoken at over 2,000 colleges, and it's been a heck of a life. But politics changes everything. And now there is no longer a market for a motivational speaker or an informative speaker talking about their life in front of large groups of people. There's just no market for that. And so what that really means is all of my wonderful experience that I've had in the last 30 years, serving on all of these wonderful boards and doing all these wonderful things, makes me completely unemployable. It really does. Because honestly, the last time I ever had to write a resume was back in 1996. When I started working for Lucent Technologies. I used to sell telephone systems door to door. I would hang a telephone system around my neck, and I would climb a flight of stairs to get to the second floor lawyer office in small downtowns that still weren't accessible from ADA. And so they knew they needed to make things accessible. They always needed telephone systems. I was selling voicemail, right? And so people would buy from me, and that was very successful for me. But that was really the only time I've had to put together a resume in the last 30 years. Um, the problem with that is now when I want to come back into the work environment, specifically because I used to contribute. I used to have an identity as a helper. I used to be the one that would come in and they would always say, "We're so glad you're here. Please help us with all the good information that you have." And I would go, "Yes," and I would do my thing. And they would go, "Oh my goodness, that was so amazing." And that really validated my identity. But mostly that's gone away now. And so I found myself sitting at home, not like I have to have a job because there's wonderful support systems and I did pretty well during my times, but what I really want to do is contribute again. And so all of a sudden I started getting emails from the policies and partner, the organization. It was wonderful. They sent out so many emails and they were talking about this wonderful fellowship. And I went, well, of course, a fellowship, that sounds like something I should absolutely be able to do. And they were so nice to give me a half-an-hour interview. And in the beginning of the interview, they said, "We've got 5 questions for you. And what we'd like to do is just have you look at the questions and then, proceed to answer them." And I went, "Okay, great." And they asked me the first question, and then I talked for 28 minutes. And then Sally stopped and she's like, "Well, you only have 2 minutes left. And there's 4 more questions, but I think we should just end the interview right now." And I've suffered defeat in the Paralympics. I've not always had successful relationships, but I haven't screwed up like that in a really long time. And so I wrote a letter saying, "Hey, can I do a redo? And I'm in a wheelchair." And people usually say yes. And Sally said no. And so then I was completely blown away because the thing that I thought I would be most perfect at, working within an organization for people with disabilities, I'm supposed to be the hero, and I failed. So then I started applying for jobs through the state of Wisconsin with no practical work experience. Yeah, exactly. And so I did that for about 4 months. And then all of a sudden I started getting emails from Sally again, talking about this wonderful internship. And I was like, "An internship? Oh, please, 6 months, that's not even." And then all of a sudden I was like, things come to you in time. And so life gives you hints. Why not try again? And I wanted to have a second shot at the interview for something, right? And so I applied and I was wonderfully granted the access to have another interview. And this time I stopped talking after 4 minutes for the first question. And then I answered the next one and the next one. And they saw in their lovely world the chance to give me an opportunity. And the opportunity was to work as an intern. And then she said, "Where do you want to work?" And I drive quite a bit. It's one of my favorite things. I always tell people, I'm not exactly a good walk around guy, but boy, oh boy, the highway system is very accessible because able-bodied people don't put curbs in the middle of highways, right? And so it's a way for me to get out and see the world. I love transportation. I notice all the differences that they're doing with all the bike lanes and stuff like that. And I've got a hand cycle that I do marathons in New York City and all over the world. It's pretty cool. But I wanted the DOT. And then I had the opportunity to work within the DOT. And they actually gave me a wonderful opportunity to work in 3 different specific divisions of the DOT. Now, here's the cool thing about being in a wheelchair. Everybody assumes that you're an expert at wheelchair stuff. And I'm not. And so then I had the biggest case of imposter syndrome I've ever had, because now I'm sitting in meetings and they're, asking me to do things. And the first thing was working in DTSD. Let me bump in here. And what they wanted me to do was start going through all of the existing forms on the outward-facing website of the DOT and making sure they were all ADA compliant and meeting all the expectations. Like I was some kind of lawyer with some kind of experience in ADA in my background. But my dad always told me I'm in the business of saying yes. And so I said, "Yes, no problem." And then I had to go home and I had to read about all the things that they were asking me to do outside of the, and so I could come back and actually deliver on that. And basically the internship, the way they set it up was baby steps. And so the first thing they did is they put me at a desk right on the corner of the 9th floor of the new Hills Farms building in Madison, which is where a lot of the executives and the people in the DOT were. And I was all by myself. All the other booths were totally empty, all of the little cubbies, and I was there. And then they gave me the chance to come in every day. And luckily, I have easy access to transportation. And so I would get there early in the day, about between 6:45 and 7 o'clock. And I had a very nice smiley face, and I greeted all of the executives and every single person. They all had to walk past my desk as they got to all of their things. And I asked my supervisor, June Coleman, I said, is this a technique that you're using? And she said, no, this is the first time we've ever put someone there. We just didn't have any other desks. And I said, well, this is wonderful because it's an opportunity for me to meet everybody and say hi to everybody and be kind to everyone in the morning. And so I was able to build a lot of relationships simply from smiling at people as they walk by every single morning. And so again, all these things are wonderful little hints that they're trying to give you. And luckily I was aware enough to take advantage of these wonderful things. And so I ended up developing the 2025 Effective Communications Plan for Accessibility Accommodations. If anybody ever needs to know how to hire a translator or what the correct state policies are for any kind of translations, I wrote the policy for that. And then I revised the ADA related outward facing web pages because they weren't ADA compliant. And then of course I had to update all the interactive forms online. And so I had to do all of that outside of the internship because I couldn't look like I was learning all the things at the time. And I was constructing my forms in Word. And then June came to me and she said, we really need you to, put these together in Adobe. And like an idiot, I said, well, I would have to learn Adobe in order to do that for you. Isn't there someone who could do that? She goes, no, that's your job. And so I had to go home over the course of a few days and learn Adobe and processing all the things in that to meet their needs. And then DBSI, that's where June Coleman was. That's the Division of Budget and Strategic Initiatives. What an amazing place. It's filled with people who are not only good at their job, but they really want to help. And so what I found is if you're a person who is trying to help yourself, other people will notice that and they will try and help along the way. The first thing they asked me to do is to create a sample RFP for paratransit in rural areas. And I said, oh, that'll never work. And they're like, what? And I said, well, I used to run a wheelchair sports foundation out of St. Louis, and it's great to be able to bring people to a place where they can learn wheelchair basketball, but we weren't really teaching wheelchair basketball. We were putting together a transportation system for people with disabilities to get there because most parents don't have the expectation that they should be transporting their kids with disabilities to an athletic event 2 to 3 times a week because that wasn't really in their plan. And so they didn't have the infrastructure for that. And so I talked about how difficult it was and how, there'd be no way to turn this into a profit-making, thing. And she goes, oh, we don't have to make profit here. These are the things we have to do by law. And so what we need to do is create an RFP to go out and figure out the best ways to put these together. Oh, I'm sorry, request for proposals. And so we have to put that out there so people can come to us with the ideas on how to get these things done. And I was like, oh my gosh, so there's actually hope. I've worked in the for-profit world and SHRM, which is a Society for Human Resource Management. So I come from HR, all my volunteering experiences. We're trying to help them hire people with disabilities through the appropriate accommodations for apparent and non-apparent disability. So I have a little bit of experience in that, but from the private sector. And so if you can't make money on it, we're not doing it. You've got to be kidding me, right? So coming into the workforce from the state of Wisconsin, where it's mandated by law that they at least try, all of a sudden I had hope for people with mobility impairments actually being able to take advantage of the transit system. And I guess 80% of the people with mobility impairments don't have jobs because they don't have easy access to transportation. And so that's where the meaning in the work started coming for me to be able to motivate myself to try and really help out and do these things. And so I had to learn all about what an RFP was, all the different parts of it, and then, put together as best as I could with my information, wonderful rough drafts. And the beautiful thing about it, in that division, they don't expect you to have everything perfect. What they want is you to try, and then they'll teach you how to improve on that. And over the course of 5 months, I had a really valuable document that they are looking at funding this fall and next year to actually try and figure out the best way to do a paratransit in rural areas in the state of Wisconsin. And there's 2 successful programs, one down in Platteville and one in Door County right now that we can use as successful models, which it's very exciting. And then I was also, again, in the business of saying yes. And so if there was ever an opportunity for something to be happening in the building and I'd see a poster, I'd go and I'd call that person and say, hey, can I help out with that too? Because it always gave me practical experience that I could use with other things. And so I was able to help out with the Safer Together campaign. And then about 2 months into the program, they must have assumed that I was pretty good at my job, because I had someone from OBOC is what they call it, and they came to me and said, we're having a problem with people reporting that our outward-facing website is not accessible, not ADA accessible for all the adaptive and assistive technologies that people are using to try and read it. And if we are not accessible by 2026 in April, we're going to lose all of our federal funding. And I said, wow, I can't believe you guys aren't on this. And they said, well, we actually are. We have a department here that has been already certified that we're accessible, and we pay an outside organization to develop an AI to make sure that we're fully accessible. So we were absolutely compliant, but they still weren't accessible. And I said, so, what do you want me to do about it? And they said, well, what we need to do is put together a group of people who use the assistive and the adaptive technology to try and test our website to see where the friction is to try and make it better. And I said, if we're already accessible, how can we make it better? Because legally, we can't do any more one specific thing to accommodate one disability over another. Otherwise, we'd have to do everything for everybody. And so what June said was, we might not be able to make it more physically accessible, but what we can do is make it more intuitive for everyone. And if there's obvious problems with the existing adaptive technologies that we can uncover, we can make those changes to try and make it a little bit more intuitive for those adaptive technologies to work within the website. And so I reached out to a couple of people through DHS because, again, Sally's an amazing person and she has connections everywhere. And I explained to them that we were trying to put together this ADA feedback group to try and evaluate the outward-facing website for accessibility. And they pushed my interest email out to all the different organizations that help people with disabilities in the state of Wisconsin, and we got 15 people to participate. And then all the way through the process, those 15 people went through and we ran clean. Every single person participated, completed the survey, and we got some amazing documentation that, first of all, it wasn't as bad as everybody was saying. Through the adaptations that we've made in the last few months while I was there, we really did create something that was generally accessible for everybody. And if there was individual friction, we were able to go back and talk to the people who were creating the assistive technologies and figure out better ways to make it interactive. And so we were completely successful. And because it was such a great opportunity for me to be successful, June thought it was important that I was allowed to talk to Christina Boardman. She's the deputy, or she's the secretary for the Department of Transportation. For the state of Wisconsin, I was able to present our findings and then be seen by them too, and Scott Lowry, the assistant deputy. And so the internship was a real amazing opportunity for me to not only develop my skills in specific areas that I didn't have before, but it gave me an opportunity to learn culture within the workplace that I had never experienced before, because I always came in as a high status person, bringing value to them that way, but not actually someone who is part of the organization and learning what was important within the organization. So just a few of the lessons learned. Every culture that you exist in is different, and take some time to understand who you are in the room and what's expected of you in every situation. Well, a week and a half into my first, part of the internship, I was included in a WINDAC meeting, which is the Wisconsin, a group of people who don't actually use the transportation system, but because it's not accessible, but we're trying to make it accessible. And I was part of that committee, and I didn't know who I was in the room because I didn't realize the person who was the fourth most powerful person in the state of Wisconsin was also in that room. And she was asking questions to a person who I was friends with named Marina. And Marina wasn't giving the kind of answers that she wanted. And so I was trying to be supportive and say, well, I don't really necessarily think that, she might not have all the information to be able to answer the question that you're asking. And I was immediately disregarded, and I was detoothed. And basically, it was, you should know who you are in the room. You shouldn't even be speaking now. And I didn't realize that I was making such a huge mistake because I didn't I wasn't prepared in the meeting because I didn't know what was happening. And I thought it was just a group of 4 people who were trying to solve some problems. Like most of the meetings that I've been in my life, I didn't realize a hierarchy within the meeting was so strict. And so I embarrassed myself. And luckily, Leah allowed me to be in the meeting in the 2 weeks, and then I just sat quietly and learned what was happening in the meeting instead of trying to be a direct participant, because again, I didn't know who I was in the room. And so I thought I was credible because every time I walk into a room, I'm credible, but not in every situation. And so that one of the things I learned. We all want to help, but clarify the ask before you jump in and try and make improvements. Exactly. Volunteer and take initiative. Be there in person as often as you can. Sally said, well, if you can go in, go in. And I was like, really? And they gave me a desk. And they said, you could work from home if you want, but I knew the value of being there in person. And so it was one of the things that I did, and it really probably gave me more credibility within the people in the building than I would have had if I hadn't. In fact, they asked me to do a lunch and learn, and just sharing my experiences and part of a presentation that I had done nationally. And we had over 167 people attend, which is more people than they'd ever had attend a lunch and learn before. And so I was able to be around, but then after I did that, I got to be friends with people in the elevator and walking around, because all of a sudden people knew my story and I demonstrated value in another way. And so take advantage of any opportunity that they offer is what I would recommend there. And say yes to everything if you have the support. It's a great way to combat imposter syndrome. And so after I started being recognized for the things that I was doing and the accomplishments that I was having within the different things that they had asked me to do, I really felt like I belonged. And again, be what you want. The best way to show people who you are is to show them how you fit into their system. A lot of times, because I'm a person with a disability, I usually come in and would criticize, well, that door isn't working. Or, boy, that bathroom isn't accessible. I know the rules for ADA. That was part of my experience when I would go around. People would, ask me, so, how tall should a drinking fountain be? And what's with that cutout underneath it and all that stuff? So I know a lot of that stuff. And so I thought I was bringing value by criticizing those things. And the issue is, yes, they wanted to know about that, but that wasn't really why I was there. And so they weren't congratulating me and giving me all the feedback that I thought I deserved for fixing all the little problems around the office, because that's not what they really wanted. And those were things for me. It wasn't necessarily things for other people. And so I had to learn that the things that I thought made me valuable weren't necessarily the things that they thought made me valuable. And let's see, I talked about the lunch and learn. I did receive practical experience within all 3 divisions. And at the very end, when I was speaking with Christina and Scott, June said, don't just talk about the wonderful things you did with the ADA feedback program, but tell them a little bit about what you learned from the internship and what was valuable for you. And it was at that point that I realized that what they had truly given me was an identity, because I didn't know what kind of jobs that I should have applied for with this internship until June said, she goes, with your work experience and the things you've done here, you are a policy analyst. And I went, oh, that's kind of nice, because you aren't the thing that you are until someone who is that thing or manages that thing tells you that you're that thing. It's kind of like the magic of the Wizard of Oz, when the all-powerful Wizard of Oz came and gave everybody the identity that they thought they were. Exactly. And so the internship actually gave me the identity to know that I was valuable, and my skill set does translate into something that's practical within the Department of Transportation or state jobs. And then truly what she did and what the internship did was it gave me practical work experience that allowed me to take my talent stack of all the things that I'm good at and translate it into specific things that I can use as examples and value that I can talk about when I'm in job interviews. So in the past, I would always talk about the things that I thought were important about, disability and overcoming and all that stuff. That is not what they're looking for in a state of Wisconsin job. They're looking for actionable steps that you've taken within specific examples that they understand. And so now, because I had the experience and I've done all the work in the divisions, now I've got things to talk about that they understand, which will make me a better candidate. Not saying that I've been able to translate that into a job yet. I haven't, but I am not giving up. And every single day, I go onto the Wisconsin Jobs website and I look for jobs that I think I'd be appropriate for, and I create the custom resumes and the letter of qualifications. And I've been very successful at getting the interviews, but not translating the interviews into jobs because and again, one of the beautiful things about the internship, the people at the DOT want you to get a job. And so after I fail at an interview, I reach back out to the HR person and I say, "Hi, my name is Matt. I was part of the internship program. I was just wondering if I could receive some additional coaching from, the people who actually," and about a third of the time they say yes because of the internship. Normally, they don't respond at all because they can't be sued, or they would be sued by people saying, "Well, that's what I did." And so I've been very fortunate to be able to get coaching. And the last coaching that I received was, you're really good at selling yourself, because that's what I've had to do my entire life. But that's not what they're looking for. They're looking for evidence that I could fit into their system and do the practical things that the jobs would require. And so now I'm trying to translate my experience into that, so I'll be a better candidate for what they're looking for. But again, I wouldn't have any of this if it wasn't for Sally, and especially she continued to believe in me after I embarrassed myself that first time by talking for 28 minutes, not even answering the
Not
first
embarrass
question.
yourself, but you did reach out for feedback after.
Well,
So, I mean, I think that was what was important is he reached out for feedback. And I said, if you can't you have to get through the questions. The other candidates got through the questions, right?
it's true.
Yeah. So any questions about the internship or questions for Matt? Matt is also going to be doing a 30-minute presentation later this afternoon.
A little bit of this, but some more stuff too.
Yeah.
July 1st. It was January 1st it was
Yeah,
to
it was
1st of July.
6 months.
Yep.
And so we kind of kept with that. So it was that full 6 months. Yeah. So right now, Jenny so our goal was we had to place one person by the second year. So I achieved my goal in the first year. So Jenny got a job. We have, and Danielle just left. Family Voices was one of our agencies who did an internship. And I just saw that they posted that they gave a position to the intern that they had. And then we also had an intern at the Division of Quality Assurance, and they extended her in a limited term employment. And so she is just going to be wrapping that up in October. Yeah. But they were hoping that was going to be a bridge to keep her. So we do 2 fellows a year, and we have funding to do 8 interns. And so we placed 2 fellows and 7 interns finished the program. So we are recruiting for 8 interns right now. So those applications are out there and they're due by October 31st. And I think, one of the things is what we do from the agencies or the organizations is we ask them to submit to us before the second interview process. Our process is there's an application and then there's a 2 interview process. And at that second round of interviews, we have the options for the placements that we let the candidates respond to see what is going to be the best fit. And I think we got really lucky. We just had the right fit. Everyone seemed to be a good fit. And, so Matt had definitely the skills that they were looking for at the Department of Transportation, even though he might say he didn't, he absolutely did. And I think that's the thing is we've really seen that, the individual and the placement can really make the most of it. And so it's about, there is work that they have to do that they have to fit in, but they can also look at those person's strengths and skills and give them projects that work the best. Any other questions for Matt or about the internship? All right, I'm going to take the clicker back.
Okay.
Yeah, I'm almost done.
You have the con.
All right. So again, that application is on our website, and we are currently recruiting for those 8 internships that will start sometime in January. You can always contact me if you have any questions about the application, need any assistance. You can email me or call me. One of the most important things, and we really like to talk about this because this was something that we have learned along the way. So we always get a lot of questions about benefits. So if you're a person with a disability who is on benefits, you know, it's very important that you understand how this might impact your benefits, because it really is pay. So you're receiving, even though you're working under a contract, it really is considered income. So we do really encourage everyone to seek out benefits counseling. So that's work incentive benefits counseling. So that is what allows that helps people understand how they can keep their benefits, so like your Medicaid, your family care, your IRIS, and still be able to work. And so people can receive work incentive benefits counseling through a couple different programs. If you're involved with the Division of Vocational Rehab, if you have family care, IRIS, or if you're on SSI, they have programs that will help you get connected with someone who does benefits counseling. We do not do that, but we can give you information about where you can go. And there is a link here for that work incentive benefits counseling. And we ask that anyone who is on benefits and is applying for the internship, that you do start that process while you're going through this process. Our process right now is we'll end the application period October 31st, and then we will be doing interviews in November and into December, and then placements in January after the holidays. But if you don't have that benefits counseling done and you can't start, then it could impact a potential placement. So we ask that people are kind of doing that at the same time they might be applying for the program. All right. So the application is online. It is all online. We ask that you include a resume. So you have to have a resume of some kind. We will ask for 2 references. We're trying to get more professional references, so not your mom, not your aunt, but professional meaning maybe somebody that you've done some volunteer work with, somebody who might know about your advocacy, your grassroots, whatever that might be. So we're looking for those types of contacts. We have 3 open-ended questions in the application, and then we'll be doing those interviews in November and December. When you're looking at the application, there's a list of required and preferred. So really be thinking about that when you're preparing your resume, because we follow our state procedure. We have a score sheet that scores you on the application, and so we're trying to learn as much about you and how you meet those required and preferred areas. And so you have that opportunity to do that in your resume, but then also in the questions that you would answer. We don't interview all candidates. The last fellowship, we had 40 people apply, and I think we interviewed 20 in the first round and 7 in the second round. So, it is, and our interviews are 30 minutes. So we do, like Matt said, we try to keep 4 questions maybe, but and keep within that 30 minutes. But that's just a little bit more information about the process that we're going to go through. All right, I'm just going to check the time to see if we have time for an activity. We do have it. It goes till noon, right? Okay. So we wanted to give people an opportunity to really think about what skills and strengths that you might bring to the program, and what do you hope to gain for a future career. So on your table, there are some sheets. And so we just thought if you want to take a couple minutes and write down some answers, and then we'll give you a chance to share with us. So what you've heard about the program, think about what those skills and strengths you might bring, and then what do you hope to gain for a future career if you're interested in a career with this? And if you don't have enough sheets at your table, I can grab some for some other tables. So I'll give you about 5 minutes and then we'll just get some feedback from you. Does that sound good? All right. All right, I'm going to do a check-in. Does anybody want to share what they wrote? All right.
Hi. Oh, sorry. Sorry. Hi. My name's Frank Berger. I'm a client of my choice. But my goal in life is to create a program where kind of get the good programs that I've been through in my own life situation um more out there. um I've been through many different programs throughout my life. Uh had some past issues with my school system, bullying, assaults, all kinds of different stuff. And because of that stuff, I've gained a lot of, well, quirks, as my mom calls it. But I have Asperger's and depression, anxiety, PTSD. Um, but mainly my strengths and skills, um, I look at myself as more of, I have a different understanding of like what it's like to be a client, and through struggles and through different programs and different ways of things were run different ways. Um, uh, I've been through a lot of programs where they taught me a lot of good things. Living on my own, cooking skills, the whole 9 yards. Um, what else? It's hard to read what all I wrote through. Um, uh, I live in Berlin, Wisconsin now, but I grew up in a small town, Algoma, right on the arm of Wisconsin, Kewaunee County area. Um, Kewaunee County, not the greatest for programs, very far in between. Um, I've also lived in Green Bay, so whole different type of situation. Um, I've uh, I've done the bus system. When I lived in Green Bay, which was a big learning process from a small town where you could walk 10 minutes across town to takes you hours. Different kinds of people, had to learn how to navigate different things in my life where, you know, you just don't go up to a grocery store and say, "Oh, hi, how's your day going?" um, I've also learned a lot of things where, especially in small communities, where some things are not always available. Or when I grew up in Algoma, where people that I had issues with in my past because of stuff that had happened, you had upper levels of management. Um, One of the peoples I had an issue with, he was a superintendent through the school, and he was part of the county board, which I had issues with, which was on the news actually with him, but um, but had a lot of issues with that. And then again, with my career, I want to create a program where the intermediate person, so like sometimes I've been through Lakeland, I switched to my choice. Lakeland, I had a lot of issues with communication, miscommunication. Sometimes they wouldn't answer their phone for weeks on end when you needed something. I want to create a program where I can be like, okay, here is the client. Okay. Hey, I need transportation, but I can't get a hold of my care team. Okay. I go into the facility or into Lakeland's building itself and be like, hey, I have a client. He's been trying to get a hold of this such and such person. Why isn't this being done? And it needs to be done yesterday, you know.
Yeah, that's great.
A lot of that's different things, different programs of getting other small community programs together because of the way the world has been going with money wise and financials. Kind of combining the small communities into a bigger group where
Mhm.
we can put all our funding together and be like, hey, you know, you do this
Great.
department. Okay, you work with the school, you work with young children. Okay, that's great. We'll have you in a section where we can push that. Oh, you deal with older kids, teenagers. Cool. Different section. Just and that's why I've actually come to this conference is just talk about the different what could be better and what things could be different. And I'm looking at all the different programs and all the different places that just like today talking with you, sir, and sorry if I forgot your name again, Matt. Just different people, different connections and where I can go and who I can get a hold of. So
Awesome. That's great. I really like you have a lot of lived experience and I think the rural aspect, that's really important. I think a lot of the work is done in our bigger cities. All right. I think I have time for, oh no, it's noon. Did anyone else want to go? All right. I'm going to let you go to lunch, but Jenny's got something to say.
I just want to piggyback on what you said, because when I went into this fellowship, I didn't know that I wanted to work for the state. And one thing Sally said to me was, well, you may not end up doing that. It's not a requirement of this program. So what I want to say to you or anybody else that's thinking, well, I have this idea for something I want to do, you will learn so much in this program that would help you do some of the other things you're thinking about doing in your community. So I just want to add that.
Yeah, for sure. We don't expect you necessarily to go to work where you were. Do you have to tell them anything? Okay.
Okay, just a reminder, on your table is our little sheet, and you're just gonna rip to say how well you liked the session. So 5, you ripped near 5, or you can circle 5 if you really liked it, on down to 1, not so good. And then if you want CEUs, the secret word is support. Support. Thank you.
Just leave the reviews on the table. All right. Thank you so much. Have a great lunch.